You might be surprised, but even if no one is around, you can still survive a stroke if you know exactly what to do. There are 5 critical actions you need to remember to respond fast and correctly, because every second can mean the difference between life and death. Don't overlook this. Even one of these steps could save your life or the life of someone you love. First, prepare a personal emergency kit right next to your bed. This is something you can do today, especially if you live alone and want more peace of mind at night. In a true emergency, this simple setup could make all the difference. Use a small box or bag and place it somewhere easily within reach, like your bedside drawer or nightstand. The most important item in that kit is your phone, and make sure it's fully charged every night. Next, save 911. As a favorite contact or under an easy-to-find name like emergency. Also include numbers for trusted family members, close friends, or reliable neighbors, people who could respond immediately if you call. If you're able to call emergency services, use speaker mode so you can speak more easily if your grip is weak. And most importantly, don't hang up unless the dispatcher tells you to. Keeping the line open allows them to monitor your condition, provide instructions, and guide first responders directly to you as quickly as possible. This one simple habit, keeping your phone within reach and ready, could be the thing that saves your life when seconds count. Second, this could truly save your life is a sheet of paper with your personal medical information. Take a few minutes to write down your full name, date of birth, and a list of all medical conditions you're currently being treated for, such as high blood pressure, diabetes, heart disease, or high cholesterol. Next, list all medications you're taking, including the exact dosages. Don't forget to note any known drug allergies. This is especially crucial in emergencies. At the bottom of the sheet, write down the name and phone number of your emergency contact. This could be an adult child, your spouse, or a trusted neighbor. Keep this sheet next to your phone or clearly visible inside your bedside emergency kit. If you're unable to speak when emergency responders arrive, this paper could help them make fast and accurate treatment decisions and avoid losing precious time. You might also include a small bottle of water, easy to open, in case your mouth gets dry, but do not drink if you have trouble swallowing. A small flashlight is useful in case of a power outage at night. And if you want to be extra prepared, keep a whistle or personal alarm device nearby so you can call for help if you can't reach your phone or speak loudly. Preparing these simple items and knowing how to use your phone properly in a stroke emergency is your first line of defense. It can help you respond faster and increase your chances of survival and recovery, even if you're completely alone. This isn't just a suggestion, it's a practical, potentially life-saving step you can take for yourself starting tonight. 2. How to spot the earliest warning signs. If you live alone, your chances of surviving a stroke depend heavily on whether you can recognize the warning signs, especially the ones that most people don't expect. Some of these symptoms may even appear right after you wake up. Unfortunately, many people ignore these subtle signs thinking they're nothing serious until it's too late. When it comes to stroke, remembering the F.A.S.T rule can be life-saving. These are the signs you must check immediately. F is for face. Look in the mirror or gently touch your face. Does one side droop or look uneven when you smile? A is for arms. Try raising both arms. If one arm feels noticeably weaker or drifts downward, that's a red flag. S is for speech. Try saying a simple sentence. If your speech is slurred, unclear, or hard to understand, take it seriously. T is for time. Even if the symptom is mild, call 911 right away. With stroke, every minute matters. Millions of brain cells die with each passing minute. Besides the F.A.S.T symptoms, don't overlook other sudden warning signs like numbness or weakness on one side of the face, arm, or leg. Many people experience these symptoms first thing in the morning. If you suddenly find it hard to understand what others are saying or feel confused for no clear reason, it may be a sign of brain damage. Sudden vision problems in one or both eyes, such as blurred vision, double vision, or partial vision loss, are also critical signs. Unexplained dizziness. Unsteady walking, poor coordination, or sudden loss of balance should never be ignored. And don't brush off a sudden severe headache. It could be an early warning sign of stroke. For older adults, especially those who live alone, these symptoms can easily be mistaken for just getting older. But don't ignore them. Even if they go away quickly, it could be a transient ischemic attack. A clear warning that a major stroke could be on the way. Never underestimate any of these signs. Your life could depend on it. Number 3. Call 911. As soon as possible, the moment you even suspect a stroke, even if the symptoms seem minor, the most important thing you can do is call 911 immediately. Don't wait to see if the symptoms go away. Don't try to drive yourself to the hospital, and don't worry about overreacting. Calling 911 is the fastest and safest way to get advanced medical help, which can greatly increase your chances of surviving and making a full recovery. Remember this: a stroke is not something you can sleep off. Every minute you delay causes more damage to your brain. But when you call emergency services, trained professionals are dispatched quickly. They have the tools, the skills, and the knowledge to take action right away. They can also notify the hospital in advance to prepare for your arrival. If your condition suddenly worsens on the way, there's no way to handle it safely on your own. Driving yourself or even having a family member drive can put you at greater risk. Let the experts do what they're trained to do. Save your life. You don't have to be 100% sure you're having a stroke to call 911. Emergency operators are trained to assess the situation and send help when needed. Their top priority is your safety. They would rather send help for a false alarm than miss the chance to save someone in real danger. Get familiar with the emergency call button on your phone. Practice using it and make sure you know how to reach help when every second counts. Number 4. Lie on your side and do not push yourself. After calling 911, many people feel restless, anxious, or think they need to do something to take control of the situation. But in this moment, the best thing you can do is the opposite. Stop all activity, rest, and keep your body as still as possible. By staying calm and not moving, you're giving your brain a better chance to survive, conserving oxygen, keeping your blood pressure steady, and preventing further damage. The first step is to find a safe and comfortable position. Sit or lie down right away. Don't try to walk around, don't gather belongings, and don't attempt to finish what you were doing. The only exception is if you need to unlock the door for the paramedics, and only do that if you're fully alert and feel safe enough to do so. Even small physical efforts can worsen the stroke, increase pressure inside your skull, and lead to more brain injury. The ideal position is to lie slightly on your side with your head and shoulders elevated about 30 degrees. This helps blood flow better and reduces pressure on the affected area of the brain as long as you're not having trouble breathing. If you feel nauseous or think you might vomit, turn fully onto one side to prevent choking, which can be life-threatening. Most importantly, don't try to tough it out. While grit and determination are admirable in many situations during a stroke, pushing through the discomfort can make things worse. So the moment you notice any warning signs like facial drooping arm or leg weakness, slurred speech, or dizziness, stop everything, lie down, and stay calm. In this critical moment, doing nothing might be the smartest and most life-saving thing you can do. 5. Unlock the door to help paramedics reach you faster. After calling 911, if you're still alert and able to move safely, one simple but incredibly important action is to unlock your front door. It might seem like a small detail, but during a stroke, every second counts, and a locked door can cost valuable time that your brain doesn't have. Emergency crews are trained to break through barriers if needed, but doing so takes time and can cause property damage. It may also startle you, especially if you're near the entryway when it happens. By unlocking the door ahead of time, you're making it easier for medical personnel to reach you quickly and begin treatment without delay. This small act could mean the difference between full recovery and permanent damage, or even between life and death. If you live alone, especially in an apartment with multiple locked doors or a gated entrance, take time now to think through the logistics. Is your front door easy to open from the inside? Is your home address clearly visible even at night? Does a trusted neighbor or family member have a spare key? These might seem like minor concerns until a crisis hits and every second matters. That said, never risk your safety just to get to the door. If moving feels too difficult or dangerous, stay where you are. Your top priority is still to keep yourself safe and stable. But if you're near the door and feel well enough to move, unlocking it could make a big difference. You might also consider preparing in advance. Install a smart lock that can be opened remotely or with a code. Use a medical lockbox mounted outside your home with a keypad, and spare key inside the code can be given to 911 dispatchers. These steps send a strong message to first responders. You've done your part and they can get straight to work. It shortens their response time and gives you a sense of control even in the scariest moments. With the right plan and knowledge in place, you won't face a stroke alone.